All right, Christy, thank you. Well, virtual doctor visits aren't new, but the pandemic sure has forced more people to use that method. 7 News' Sophia Radebach spoke to an upstate doctor who explains why some people are still hesitant to get on board.
In a year where so many things are different, some are looking for medical help from the palm of their hand. But is the care they're getting similar?
COVID-19 has changed the way people relate, a lot of times putting technology in the place where there would normally be an in-person interaction. Healthcare is especially seeing this change. More and more folks are now depending on their computers and phones to meet with their doctors.
A lot of the things that have happened in regards to telemedicine probably would have happened anyway, but were accelerated by the pandemic.
Fourth-year medical student Dory Askin says even their curriculum has changed to meet this new standard.
One of our tests to pass the rotation at the end actually ended up being a virtual doctor's visit. So we actually got tested on our skills to conduct a virtual patient interview.
But telehealth raises some questions on how reliable it actually is. Some wonder if a doctor can tell how sick a patient is feeling. But physician at Spartanburg Regional Healthcare, Chris Lombardozzi, says he wants to put people's mind at ease.
We have found that we can still deliver the same really high quality care. And I think it's really important to say, we've made it so much more convenient for people.
Before the pandemic, Spartanburg Regional was doing a few hundred telehealth visits. But now, that number is about 10,000. He says the virtual trend might be here to stay.
It's not just emergency services, but now you're starting to see an expansion of telemedicine to rural areas. So for folks who might have to drive, an hour or two to get to their local hospital or their local doctor's office, now they don't have to do that.
Another doctor I spoke to in the upstate said one obstacle they're having to overcome is people who don't have access to the internet and folks who aren't as good with technology, but they're working to accommodate those people. In Greenville, Sophia Radebach, 7 News.
Insurance companies and the federal government are covering virtual visits because of the pandemic now, but many health professionals do hope that coverage will continue after the pandemic. New information.